Hello, everyone. Thank you for joining me. My name is Muskan, and I serve as an IT director of a healthcare clinic. And this presentation outlines a comprehensive security and privacy plan for emergency transfer of David Beckham, a high profile international athlete, to UCLA Medical Center. And because of Beckham's celebrity status, protecting his medical information is absolutely critical, and we must ensure that all the data shared during the transfer remains confidential, secure, and compliant with HIPAA, NIST, and high trust standards. So, today I will walk you through the technical, administrative, and procedural guidelines or safeguards we are putting in place to accomplish exactly that. So, for that, we are covering uh, all the main areas like detailed risk assessment, data minimization strategies, secure methods for data transfer, access control, and authorization roles, our encryption strategy, how we will handle the patient consent, staff training and awareness protocols, communication and media inquiry strategy, our incident response, and resources, requirements, and timeline. And together, these elements form a robust um, and compliant security and privacy framework. So, for the next slide, risk assessment. When we consider transferring a world famous individual like David Beckham, the threat landscape changes significantly. The first risk is unauthorized access, as staff who are not involved in his care may try to look into his file simply out of curiosity. Second, media outlets and unauthorized individuals. Many attempt social engineering attacks, pretending like they are family members or hospital staff. Third, the urgency of the transfer can lead to human error, including sending information through wrong channel or insecure channel. Fourth, we must consider device thefts, especially if the mobile device or tablets are used during transit. And finally, there are external cyber threats such as attempts to intercept data during transmission. And understanding these risks allow us to build a target protection that safeguard the confidentiality, integrity, and availability of Beckham's medical information. Next slide is data minimization principle. So to reduce the exposure, we must strictly follow the HIPAA minimum necessary rule, and only necessary information will be shared while the transfer into UCLA Medical Center, and this include his current diagnosis, his vital signs and treatment information, about his allergies and current medications, any relevant imaging if we have, and a brief transfer summary that supports the clinical decision making. And meantime, we will also avoid sharing unnecessary details such as unrelated past medical history, detailed demographic data, family information, and financial information. And because by limiting the amount of data transferred, we can significantly reduce the chance of unnecessary disclosure or misuse of the information. So the next slide is secure data transfer methodology. So to securely transfer the Beckham's information, we will rely on the HIPAA compliant and encrypted channels only. So our primary method will be direct EHR to EHR transmission using HL7 or FHIR standard, and UCLA Medical Center use a compatible system, so this allows encrypted control end-to-end transfer. And if technical issue arises, we can secure file transfer protocols such as SFTPS, SFTP, or high trust certified encrypted cloud platform. And other alternative would be direct secure messaging, which provides encrypted email like communication specifically for healthcare organization. And all transfer will occur through VPN tunnel with a strong encryption to prevent interception or tampering of the data. The next is access control and user authorization. So, access to Beckham's data must be tightly controlled, and only staff involved directly in his treatment or transfer will receive authorization. Here are the roles and permissions, such as IT director. which is me, uh, can oversee authorization and ensures the compliance. Then comes the attending physician, uh, will have the access to chart and to prepare the medical summary. Then lead nurse will add clinical updates. Medical record team will oversee accuracy and HIPAA compliance. Transfer team will not have an access to data except physical transfer only. And we can implement strict technical controls, including role-based access control, multiple factor authentication for all logins, and automatic session timeouts, and all monitoring of all access through audit logs. And any break the glass emergency will be flagged immediately and investigated thoroughly. And the next slide is encryption strategy. To secure Beckham's data both in transit and at rest, we will use industry recognized standards aligned with NIST guidelines. All information transferred electronically will use TLS 1.3 encryption, and our VPN connection and encrypted channel will use AES 256 encryption, which is currently considered the gold standard. And within our system, all patient data stored at rest, include backup, is also encrypted using AES 256. And this layer encryption strategy ensure that even if the data is intercepted or device is lost, the information remains unreadable and protected. So the next slide is patient consent and authorization. So, because of Beckham's public visibility, the consent process is more sensitive than usual. So, we will begin by presenting an informed consent form that clearly explain what information will be shared, why it is necessary, how the information will be protected, and who will have the access to information. So, Beckham on his designated legal representative must sign the form before any non-emergency disclosure are made, and HIPAA allows necessary disclosure in emergency, but security concerns add transparency, legal protection, and trust. We also ensure privacy during the process. No other staff, essential personals are allowed near the room, and absolutely no media should be present over there. The next slide is staff training and awareness. So even the best security plan fails without informed staff, we will conduct a rapid but mandatory training session covering. First is HIPAA privacy and security rules, minimum necessary standards, proper handling of protected health information, avoid phishing and social engineering, in considering threat awareness and correct procedure for handling media inquiries. And training will conclude with a short acknowledgement form confirming that staff understand the sensitivity of Beckham's information and consequences of violating the policies. So proper staff education is one of the most effective safeguard against breaches. Next comes the media inquiry and communication strategy. So, with a high profile celebrity, yet media interest will be intense, and journalists may call, email, or they can even show up at the clinic. So, our policy is simple and strict. Staff must not consider or deny whether he is receiving care, and they must not comment on his condition or transfer, and all the inquiries are redirected to our designated public information officer, and the only approved response staff may use is we cannot confirm or deny the identity of a patient. So the next comes the incident response plan. So although we hope that everything goes well and transfer is smooth, and we must prepare for the possibility of data breach. So our incident response plan follows the HIPAA breach notification rule and includes the following steps. First is immediate containment, locking accounts, securing devices, and isolating affected system. Second is rapid investigation to determine the cause and scope. Third comes the notification of IT security compliance and officers and senior leaders. Then detailed documentation, including audit log review, notification to Beckham and his representative if any of the information is compromised, and notification to HSS and potentially the media if more than 500 individuals are affected, and implementation of corrective actions such as retaining or system updates. So this structured and transparent approach ensures that breach is handled responsibly and efficiently. So the next slide is resources and timelines. So to implement this full security and privacy plan, we require combination of personnel, technology, and training resources. In personnel, we need IT security team, compliance officers, medical staff who records that, clinical personnel involved in the transfer. And for the technology, we need secure EHR interfaces, encrypted communication tools, multiple factor authentication system, training modules, uh, incident response software. And for that, our timeline is for 3 days. For day one, conduct a risk assessment and deliver rapid staff training. For day two, configure secure transfer tools, verify encryption, and test EHR interferences. For day three, final readiness, check, activate communication and media policies. So this is all about our timeline. And for the conclusion, so managing the transfer of a high-profile patient like David Beckham requires a lot of careful plan. It will be well structured. So by conducting strong risk assessment, minimizing unnecessary data sharing, or using encrypted transfer, having a secure consent, and a well incident response plan will ensure that it's a highest level of protection for this personal health information. And this plan does not only meet the HIPAA, NIST, and high trust standards, but also supports and safeguard the continuity of care during a critical moment. So thank you, Professor, for listening to my presentation. And these are the references that I used for this presentation. Thank you.